Welcome back. You're still watching World Insight, the live program. I'm Tian Wei. Moving on to the U.S. response to the COVID-19 outbreak amid the Super Tuesday Democratic nomination. It's unusual for the U.S. to go into election with a brewing global health crisis. The past week, epidemic jitters sent U.S. markets tumbling. The U.S. President Donald Trump's outbreak response has fueled attacks from Democrats after the U.S. president played down risks of widespread infection. It could also be a test on the U.S. healthcare system, the only one among industrial nations that is not universal. Health officials have raised the questions on the system's ability to respond to an outbreak. But certainly, we all hope things will calm down in any part of the world, including in the U.S. But now, how well is the U.S. dealing with the COVID-19 outbreak this time? Let's get some answers from some real people in the know. In New York City, we have Dr. Thomas Frieden, a former director of the U.S. CDC, the Center for Disease Control and Prevention, under the Obama administration. He's currently president of the Resolve to Save Lives, a 5-year initiative to prevent epidemics and cardiovascular disease. I guess we're inviting the right person in this regard. In New Haven, we invited Xi Cheng, an associate professor of health policy and economics at Yale School of Public Health. Welcome as well. Let me start by asking you, Dr. Frieden, with some of your earlier experiences, what do you make of the latest decision by the U.S. CDC not to release any numbers anymore to the public about the so-called suspected cases or cases under investigation?
Generally, in the U.S., the approach we take is to tell people what we know when we know it. Often there are limited amounts of information, and the key is to be frank with that. What you've seen is an extraordinary response globally. And globally, we're really amazed by what China has been able to do with very extensive community action to control cases, particularly outside of Wuhan. In the U.S., CDC has a key philosophy, which is to be first, be right, and be credible. And that's why you saw Dr. Nancy Messonnier, who's leading the response at CDC, level with the American people some time back. She said, there are going to be more cases. Get ready. It may spread in the community. That's the kind of free and open communication that makes the CDC one of the most respected institutions in the United States. And it's why people believe CDC when CDC says things. Currently, you're seeing a lot of confusion. There was a problem with the test kits, and a lot has to be done to make up for that.
We hope the CDC also in the U.S. this time will function as it used to be, as a good model. However, Dr. Frieden, there are questions, as you said, about the test, particularly about whether the CDC policies toward who to test and who will have the access to test, and whether it is as much as $3,000 US or even $4,500 US in some localities in the U.S. to have one test like that. Who should have access to it? Whether only rich people could have access to it. Dr. Frieden, as someone who served in public office, what do you make of all of these controversies?
So there was a problem getting this test kit out. I don't know any details. I'm not in touch with people there now. In the responses that I oversaw for H1N1 influenza and the Zika virus, the CDC laboratories produced hundreds of thousands of test kits very rapidly, distributed them not only to every state in the United States, but to more than 100 countries around the world, and we didn't have a problem with it. So something has gone wrong with this test kit. We'll need to look and see what went wrong to prevent future problems. Right now, they're scrambling to make the tests more widely available, and we hope that in the coming days and weeks that will get resolved. The test should be free to patients. In fact, all public health services should be free to patients.
But Dr. Frieden, you know better probably than anybody else that this epidemic, as earlier being illustrated by Dr. Aylward from WHO, is fast, really fast. So if we talk about days and weeks, it's going to be a lot of dangers. As we have seen also inside China, we experienced that firsthand. Everything has to be really fast. Dr. Frieden, I'm sure you know that.
Yes, absolutely. What the U.S. has done is to allow hospitals to use their own tests and to allow commercial companies to make tests as well. And that's why some of the questions on cost have come up. The test shouldn't cost very much. It's a relatively straightforward test, but the patient shouldn't have to pay. There should never be a reason why someone would not seek care because of cost.
Mm. On the other hand, we have seen a team led, or shall we say, general by the Vice President. Of course, there are certain track record by the Vice President about public health issues that may not necessarily very supportive about his current role. However, we do wish the best of the team. However, Dr. Frieden, there's the issue of transparency, there's the issue of getting people prepared, there's the issue of all the societies should be supportive to the CDC and to the all the measures taken in order to prevent the spread of the virus. However, states are having their own authorities in the United States. I understand inside the United States, there are also a lot of public events that are going on despite of the danger of COVID-19. Now, Dr. Frieden, how would you resolve this, federal, local issue? Meanwhile, real experts were not that are in charge?
First off, today in the United States, COVID-19 is not spreading widely. There are some communities where it's spreading. It may spread widely in the coming days and weeks, but it's not. So we're not canceling mass gatherings yet in the U.S. In the U.S., there's a different approach. Each state has
Dr. Frieden, if I could ask your expert opinion.
There's a federal level, but the states also have autonomy.
If I could just jump in and ask a very specific technical question. To what would you say when it is becoming serious, quote unquote?
The approach to COVID-19 has to be to try to contain it, to end it as much as possible. If that becomes impossible, if you can't trace every contact, then you try to mitigate it or reduce the harm. And China has done a superb job of looking at different areas, just as Dr. Aylward was just saying, and taking a tailored approach to different areas. Right now in the U.S., we're trying to stay in the containment phase. In one part of the U.S., Seattle, there are lots of cases. A nursing home is hard hit with multiple deaths in that nursing home, and we're very concerned about places like nursing homes where older and sick people are living together and where the virus can have a really devastating impact.
Dr. Frieden, also we see, unfortunately, some of the stigmatization and also racial discrimination, putting tags onto, one ethnic group or another, one country or another. Here in China, we are trying to say we are against that, no matter which country that tag has been tried to put on. So, Dr. Frieden, what about the situation inside the United States? How do you, as a public health official who served many years for the White House about that issue, be able to speak up and also provide your advice, sir?
Let me make 2 points, please. First, we reject any form of stigma. It's harmful and it's also irrational. In fact, just this morning I advised WHO on an informal advisory group, and the point was made that people coming from China outside of Wuhan actually may be safer than people coming from anywhere else in the world right now because it's so well controlled in terms of COVID itself. But fundamentally, second point, we are all in this together. Whatever country we're in, whatever race or ethnicity we are, we have a common enemy. That common enemy is a dangerous microbe. And by collaborating, by working together, we can make a really big difference, improving our own health and the health of our neighbors, our communities, and our countries.
Public health officials know this very well, and I also want to invite in now Mr. Xi Cheng to join this conversation about that cooperation. How much are we seeing it played out there in the world today? It seems that everybody is fighting their own fire. What about fighting this fire together? How much have we done?
Yeah, so far I think the global community is still lacking the joint efforts. So every country is facing their own problem, but gradually every country is coming to the common point where the community transmission is ongoing, like in the US. So I think there's really need a global coordination in terms of sharing of the information about still passengers, because not all the flights are banned and not all the travels are banned. And also join hands to fund the development of antiviral drugs and vaccines. And I think domestically, the U.S. Need to do more besides what Dr. Friedman have been saying. I think at the individual level, we need to do more. For example, social distancing might be a good strategy now. We may need to cancel unnecessary social gatherings and events. And also, I think what's very important is to protect those vulnerable people. So yesterday, my colleagues and I at Yale were joined by 500 public health researchers throughout the country. We issued an open letter to Vice President Pence and the U.S. government officials to try to pay enough attention to the vulnerable. For example, their health insurance coverage is less enough. Many people, like 10% of them, are under no coverage of health insurance, and their labor market arrangement is not flexible, and they cannot get paid if they have sick and they stay at home.
Yeah, Dr. Frieden, I also want to
kind of issues.
Okay, thank you, sir. And Dr. Frieden, if I could also ask you the same question. We understand there is something different compared to SARS. At that time, there was not that much geopolitics going on, but now we have seen a cold reality of that. Dr. Frieden, therefore, people have a doubtful layer whether real cooperation could happen on as important an issue as public health. Dr. Frieden.
Public health can transcend politics. At the height of the Cold War between the United States and the Soviet Union, those two countries collaborated to help rid the world of smallpox forever. In the war in Afghanistan, the Taliban and other parties agreed to vaccinate children against polio. We can collaborate here, and the way to do that is through global health security. This is a program launched 6 years ago that identifies areas in Asia and Africa that really are gaps in preparedness. A major investment is needed, both to help these countries respond to COVID and to prevent the next epidemic or pandemic. It will cost some money, but it will save a lot of money and lives. We can work together to make the world safer. And I think we hope that the U.S. government will renew its commitment there, that the European Union, that China, that development banks will get together and say, there are too many global health security gaps. Let's work together. It's in all of our interests. We're all connected by the air we breathe, the water we drink, the food we eat. Let's work together to make the world safer from microbes.
We need to have that voice very loud there. We need to really work together on something that should save lives. And another thing about this, what we're discussing is a U.S. case. It's Super Tuesday. I mean, you have so many political gatherings. This is an election year. To what degree do you think a public health sector have to deal with this extra layer of reality, Mr. Xi Cheng?
I think the cancellation of unnecessary events and social gatherings, as I mentioned, would be very important. And but for doing that, we really need to have people, everyone who are suspected to be affected, to be tested. With that, everyone have a better information about their risk and the risk at the community. Then they can take necessary steps. I think the bottleneck currently is not the number of test kits, because those test kits are more becoming available to the test centers. And according to this, the reports, like 1.5 million test kits tests can be done in America this week, by the end of this week. But what's the bottleneck is the test centers. Because there's a capacity for each test centers to do this. So if we do not have enough test centers to do this, then the test kit may not be functioning as much as they could.
Dr. Frieden, do you agree with that? And also about the availability of tests, the quality of the test kits, and also the quality of the experts, shall we say, or people working in the test centers?
The CDC was very open when there was a problem, and they reported that openly. The healthcare system in the U.S., as in many countries, is weak in primary care. Most countries in the world don't have good primary care. That means people come into the emergency department when they don't need to, and that crowds the emergency departments, makes it difficult to deal with the real emergencies. This is a problem in many parts of the world, many countries. But I think we have some infrastructure that's helpful. Sentinel surveillance for influenza. This is also present in China and many other countries. There you can track where the infection is in the community. Infections that are severe in intensive care units. I think we'll be seeing in the coming days much more information about this. What we've seen so far from multiple countries that have done lots of testing is that in many places there aren't cases yet. The key is to track going forward. Even in China, as economic activity resumes, we don't know what will happen with future cases. That's why we have to work together and keep our guard up.
Yeah. Dr. Frieden, you worked for the issue of Zika virus. Mr. Chen, I know you also is an expert in many of the public health issues. So let me ask you also about the research area, which I also posed the question to earlier Dr. Aylward of WHO. We have seen some latest research today, as of today, from the Chinese researchers. We've noticed that 193 mutations have happened to the original virus when the spread of COVID-19 started. So what does that mean to all of us in terms of prevention and control of COVID-19? Is it going to be much more and much intense work ahead? Dr. Frieden, you go first, and then go to Mr. Chen.
Only time will tell. So far, although the number sounds high, the proportion of the whole genetic material of the virus has not changed much. And because it is spreading so widely, the evolutionary pressure on it to change may be relatively less. But we did see, you mentioned Zika, there's just some recent reports that Zika may have behaved differently in Brazil than elsewhere because of genetic changes. Those haven't been confirmed, but it's the example of another reason we need to collaborate, so that anywhere this virus is spreading in the world, there can be tests done of its genome and we can track them. But one thing to be clear, it's not enough to know what the genetic code is. We have to also know the epidemiology, how that relates to the pattern of spread and the pattern of illness. It's a puzzle that has to be put together. It's not some magic answer that's in the genes.
A lot need to be done in the pipeline. Mr. Chung, you want to go ahead also with the same question about research. What are some of the most important points we have to really get it done?
Yeah, we still need more data to judge how much mutations have been going on. But this poses a challenge to the vaccine development because the virus is keeping changing. So we need to put our best efforts to the joint hands of development and the research on the vaccine development. And this is very important because we already know this vaccine R&D is already very crowded industry. Many people are stepping in, but we need a more innovative way to join hands. For example, there's a recent model of CEPI and others trying to have collective efforts from the government and NGOs and trust funds.
Right.
So that may put our efforts into the best, more efficient use to combat this virus outbreak.
Certainly, we have heard about the CEPI approach, and we talked also to the chairman of the CEPI organization. Go ahead, Dr. Frieden.
Yes, if I can just make another point about research, treatment is crucially important. We're likely, if there is a treatment that works, we're likely to know that far before we have a vaccine, and that can be very helpful.
Yeah.
So doing rigorous, scientific, randomized, controlled trials will be important, and reporting that information immediately.
Yeah.
Sometimes in public health, we report things to the public through the media, through an official announcement before even it comes out in scientific publications, and that can be a very important and responsible thing to do.
Time is so limited, gentlemen. I really want to ask you one final question. I hope our conversation could continue. Dr. Frieden and Mr. Chen, what do you make of the next few important steps to do in order to prevent and control COVID-19 from spreading further, particularly in the United States? Dr. Frieden, you go first.
We're going to have to work at 3 levels. At the individual level, stop shaking hands, cover your cough, stay home if you're sick. At the healthcare level, surge safer. Protect healthcare workers so they don't get infected, and get ready for lots of patients many of whom won't be very sick at all, and some of whom may be very sick. And third, at the government level, fund efforts, collaborate across society, share information promptly and openly, and adapt. As we learn more, we will change our approach. Every day we learn more about this virus. Every day we're able to protect people better from it. But some of the spread is going to be very difficult to control, so we'll have to limit the harms it causes to society and collaborate with countries all around the world so we learn more and do more to make us all safer and healthier.
Limit harm inside the country, cooperate with all the other players possible. Mr. Chen, what's your take? Final words before we go.
So it's very important. I think most important to have everyone to have early diagnosis and understanding their risk. And at the patient level, provider level, and the payer level, we all need to take more efforts. And more importantly, join hands with the global community. And we cannot put every bet on the vaccine. We need to have multiple solutions in order to solve this crisis, like the antiviral drugs.
All right. Well, time is so limited when we talk to real experts. Thank you so much, the two of you, helping us to understand much more insights about COVID-19. Xi Chen and Thomas Frieden, really appreciate it. All the best and be healthy. And that is all the time we have for today. If you'd like to see more, try to find us World Inside CGTN into your search engine or check out our YouTube channel. Follow us on Twitter and Facebook accounts. From me, Tian Wei, and everyone on our team, thanks for watching. Bye for now.